Welcome to the Between Tides podcast, sponsored by Portage Learning. If you're looking to build a brighter future, consider taking an online college course with us. Learn more at portagelearning.edu. And now, on to our featured episode. Dr. Shaffer, welcome to the podcast.
Thank you for having me.
We're so excited to have you on today because we've been discussing this topic for quite a while now. We've wanted to address it with you in particular. So if you don't mind, why don't we jump in with the $1 million question and then we can deconstruct as we move along today.
Okay.
You ready?
I'm ready.
Big question of the day. Are chiropractors safe?
Yes. You can judge by our malpractice premiums. They're one amongst the lowest. If you compare it to, say, an anesthesiologist, they're so expensive the hospital pays their premiums. So overall, they're safe. I mean, there's some contraindications to being adjusted, but you have to be able to recognize those.
Yeah. It was interesting. We pulled some research from, I'm going to pull it up. It's the National Practitioner Data Bank.
Okay.
Sounds like a great evening read, isn't it?
There we go.
It was fascinating to me because, there's sometimes a stigma, right, with chiropractors.
Right.
Like, are they safe? Are they dangerous? Are you going to get paralyzed? That kind of stuff.
Right.
But what was interesting, some of the data is you're actually 10 times more likely to have a massive issue at the dentist,
Right.
and over 60 times more likely just going to your PCP, your primary care physician.
Right.
And yeah, like you said, chiropractor is actually remarkably low. It just seems like when it does go bad, it's really bad, but it's actually rare, remarkably rare.
Right.
Yeah, I didn't know that.
Well, we're going to dive into this because it's the big question. Is everybody talks about stroke.
Mm-hmm.
Well, you have just as likely a chance to have a stroke at your hairdresser or your dentist or your PCP as a chiropractor.
Uh-huh.
So
What kind of drives that on the chiropractic side?
the stroke, well, if you see on the model here, the neck has vertebral arteries in it. And some of the naysayers will say if you manipulate the neck, you're stressing that artery and it could lead potentially to a stroke.
Okay. Yeah, and for our viewers, we actually have a model of the spine here, which is also a great reminder that this is being broadcast also on YouTube. You can go there and check it out and watch us and see exactly what we're pointing at. But so relative to the stroke, when you're holding the spine model, can you kind of walk us through that? Like where are the interesting areas that we should be aware
Well, the neck is the only part of the spine that has arteries in it. These are the vertebral arteries. And some people will say a high velocity manipulation can damage those arteries, which could lead to stroke.
Okay.
But if you're a trained professional, there's warning signs. And if you do the right adjustment with the right amount of tension, you're not going to hurt that artery.
Okay. Can we just go ahead and define for listener, like when you say adjustment, what are we talking about here?
An adjustment is not a manipulation. An adjustment is a specific adjustment to one vertebra. It's a manipulation, be more of a general mobilization. A chiropractic adjustment is specific to one vertebrae at a time.
Okay. Wow.
So an osteopath will typically do a manipulation. Some physical therapists will do a manipulation. We do an adjustment.
Okay. No, good to know.
So for those in our audience who may not be familiar with what you do, can we rewind just for a second?
Sure.
And let's go back to the basics. So what is a chiropractor and what type of training do you need to become one?
So basically what a chiropractor does is he looks for areas of stress in the spine and he restores motion to that area. Usually by x-ray. Not all chiropractors take x-rays. I personally do and I recommend it. The training, well, I graduated in 1994 and the training then was 2 years of undergrad and then 4 years of chiropractic college. Now in 1998, I believe, they made it where you had to have a 4-year degree, a bachelor's degree, then another 4 years of chiropractic. So now it's an 8-year degree.
Oh, I didn't know that either.
So you are a doctor.
In the state of Pennsylvania, I'm a doctor. Now, I am not a physician, and that's just...
What's the difference?
That's a good question. So I'm licensed in Ohio as well. So I can use the term chiropractic physician. But in Pennsylvania, I cannot use the term physician. I can only use the word doctor. And that's just the way the state law is.
Okay. And then for those of us who might not be familiar, how do you define chiropractic care?
Chiropractic care it really, by definition, has nothing to do with back pain. It has to do with the central nervous system, the brain and the spinal cord. We find interference to that and we free that and let the body do its work. So it's more of a healthcare. It was founded as a healthcare system. Now, we do have great results with headaches, back pain, neck pain. But that's not the basis of chiropractic. The basis of chiropractic is to free up your nervous system so it can do its job at 100%.
So when you say free up your nervous system, is that implying like a pinched nerve or
Yeah.
something else
Well,
going on?
the spinal cord can be compressed. The nerves branching off can be compressed. So we find those areas of compression and we remove it and let the spine or let the nervous system do its job.
That's fascinating.
Now, we often advertise as low back pain, headaches, neck pain, auto accidents, but the foundation, it's a healthcare system.
So if I am looking for a chiropractor, what are some things I should be looking for? How do I know I can trust you or whoever?
Do your research. Most of my patients are referred by other patients. And it also depends what you're looking for. If you're an 18-year-old kid, you might want a sports medicine chiropractor. There's chiropractors that specialize in pediatrics. So I would find, maybe someone that has the niche that's whatever your case is.
And how do you define your practice? Are you general?
I would say general. I treat, I've treated a 3-day-old. I've treated a 101-year-old. Specialize in headaches probably more than anything. They just respond very well. I wouldn't describe myself as a sports injury or pediatric. I'm pretty much general. I would say that.
Okay. Nice.
Yeah. So is that something that if someone was looking for a chiropractor, they should ask? Like, would you say, like, do you have a subspecialty, or do you just say, like, what areas do you focus on? Like, how would you best ask that question?
I would say it depends on your condition. If it's low back, have you dealt with low back cases? Sure. Now if you, I have a woman up the street from me. She specializes in pediatrics, and I had a very good friend of mine have a breech baby while she was pregnant, and she wanted to come to me. Well, that's not my specialty, so I sent her. The woman's office is 2 buildings up from me, and they were both very happy.
Okay.
But that's her niche. That's what she does.
I didn't know there was actually that many different like divisions within
Yeah,
chiropractic
it's
care.
called the Webster technique. It's basically just for newborns and pregnant women.
Okay. Cool.
So she would be looking for something different than maybe, like I said, the high school soccer player or the construction worker that got hurt at work.
Yeah.
Do you have a typical demographic who comes to you?
The majority of my patients are women because they care more about their health than men do.
Huh. Okay.
But I'd say, I would say in general 20 to 60
Okay.
in general. Now I've treated younger and older, but that's probably the general
So pretty
demographic.
broad. That's,
Yeah.
I feel like he was just staring at us like you were my demographic.
You have a spine, you're in my demographic.
Okay.
So they have issues, right? They come in with some sort of injury or
Typically.
pain.
Yeah. Every once in a while, you'll get someone say, I just want wellness. I just want you to check me out, make sure everything's good. But they've been probably under chiropractic care their whole life.
Okay.
But most people come in with some kind of issue. Headache, injury, slip and fall, car accident. They're going to have some kind of issue. Something gets them to call your office.
I'm curious when someone does come in, especially with an injury or just pain somewhere. Is it typically an immediate relief, or what's the process look like?
Well, they'll say in general, if you respond within 8 visits or less, that's considered quick.
Okay.
But the patient doesn't want to hear that. Some people respond very quickly. 1 or 2 adjustments, they're feeling a lot better. But we're typically not treating your pain. We're treating the cause of your pain. So it's generally it's a healing process. It's not overnight.
Yep. Can you say that one more time? You said we're not treating
Your symptoms, we're treating the cause.
cause.
But,
Okay,
yeah.
That's interesting.
Yeah. Whereas if you want to treat the symptom, you just take a shot of tequila and some aspirin, and you'll be good to go. But we're looking at
Not that
why.
we've ever done it.
Yeah.
So if someone comes and says they're having headaches, well, why are you having headaches? Let's find out why.
Okay. No, I like that. I mean, as someone who's had lower back pain before, it's sure you can go like a medical or medicine route and just kind of numb it versus
Right.
like, I always want to know what's actually causing it. How do I prevent that?
And a lot of times people don't want to hear this. Pain is your friend. It's telling you, hey, we got to do something here. So, and you just want to cover that up? No, you want to fix it.
So your appointments then with your clients are maybe equal parts healing and equal parts exploration,
What do you mean by exploration?
trying to figure out what the cause is.
Well, we typically find the cause at the beginning. We take x-rays.
Okay.
I take x-rays, and the x-ray is going to pretty much tell me what's
the pain
going on.
is. Okay.
If there's arthritis in there, if there's pressure on a nerve. So no, it's not really explored. Now, if I don't take x-rays, then I'm guessing. Okay. So you could have a bone spur in the front of your spine. you're never going to know that without an X-ray or an MRI.
So in talking about the spine and how you actually treat a patient,
Mm-hmm.
I know one of the questions we always get is it's about the table. I know there can be a lot of sounds, a lot of clanks. Like,
Yep.
what's up with that? Can you explain what is this table doing?
There's a million different kinds of tables.
Okay.
Then there's a million techniques.
Oh,
So basically, when we're in school, they teach about 30 techniques. And then you kind of pick and choose from each of those techniques and you kind of create your own. So that's my technique is my technique. I pull from 10 other techniques. So the tables will drop. There's a whole technique called Thompson where it's nothing but those drops on the table. They don't put you on your side. They don't turn you on your back. Everything is just a drop, drop, drop. And the dropping just adds velocity so you don't have to put as much force in it. And that's a whole technique.
so it
And
makes your life easier because the table drops.
it's easier on me and you.
Okay.
But to me, I use some of that, but that's not my whole technique. I'll turn you on your side if necessary. So the table is made to address all those different techniques, if that makes sense.
Sure.
So, like my table can conform to a pregnant woman on her belly. It can do all the drops for that particular technique. Not that I use them all. So the tables, they can be very intricate, I guess, or confusing. But some chiropractors I know just use a straight bench.
Oh, okay.
And that's all they use. So I think it's pretty much doctor preference, and also for patient comfort.
Sure. Interesting. Okay. So when you're doing, I think you called them drops. So that's when the
It's
table
called a
kind of
drop.
gives way. But when you do the adjustments, you hear the cracking sometimes. I'm guessing is that
But you
that's
hear
fair?
popping, cracking sounds. Yes.
So I think like if I'm like cracking my neck, if it feels stiff, it cracks. Or if you're adjusting a spine, it cracks. What is going on when that happens?
Okay.
Can
So
you show us,
anytime
or-
there's two bones that come together and form a joint, there's a capsule. There's a joint capsule around there, and when you move the vertebrae, or it could be your knuckle, that there's air and fluid in that capsule, and you're actually shifting that fluid in there, and that's the sound you hear. People think it's your bones grinding together.
Right,
and
so it's not bone on bone.
It's not bone
cracking.
on bone. So I could, as an example, I can actually pull away, so you know the bone's not touching. But a lot of people think, oh, that's my neck's grinding and my bones are grinding together, and that's not the case. It's the capsules releasing gas and air.
Okay. So is the capsule, is that different than like the disc between your
Yeah.
spine?
So
Great.
it's hard to see on this model because it's so small, but these are the discs. And if you can see these small joints right here, these joints are all going to have a capsule. So there's 1, 2, 3, 4. So you could hear four pops with one adjustment.
Okay.
So, and the discs have them too, between the bone above and bone below. There's also a capsule there. So that's air and fluid shifting in the joint capsule.
Fascinating. I just imagine if someone was going in for their first time and they get like a massive adjustment or a lot of cracks, that could be alarming.
Well,
to know what that is.
And it is. And
it's
so
not bones
typically
cracking.
a new patient with me, first visit, it's very, very gentle because they're nervous, they're in pain. So it's a very gentle. And once we get comfortable with each other, we can get a little, I hate to use the word aggressive, but we can start getting to work.
Okay.
If that makes sense. But most people are a little nervous.
Sure. So, in speaking of that nervousness, like one of our biggest questions is kind of it's related to like the neck phobia, if you will. And I know we just touched on that earlier with
Right.
the arteries coming out, correct?
Right.
Can you speak to that a little bit more? Like, what are the common concerns, hesitations, and
Well,
what would you advise?
I mean, one is birth control. That's a contraindication, or not. That's a warning sign. If you come into the office and you say, every time I turn my head and when I'm driving my car, I get a little dizzy or I feel lightheaded, you're going to be a little cautious with that. And there's still ways to adjust the neck without twisting it. You can keep it in a straight. It's not as comfortable on the patient, but there's ways to still treat that patient. But you got to watch for the warning signs.
How often during like a neck adjustment? Not that you may not know all the stats right off the top, but is that a fairly uncommon thing? I mean, I know it's a big deal, so that's why you would hear it in the news or somewhere else.
I think the last thing I read, it wasn't a major. It was, what was the word they used? Incident was 1 in 100,000, and that's not a stroke. That's not anything. That's just an incident where the patient maybe said, "Oh, I got worse before. I got worse after the adjustment." That's the last I read was 1 in 100,000, and that could be just any minor. And the stroke incidence is way less than that. And I don't have those numbers with me right now.
Oh,
So.
that's fine.
So, Dr. Schaefer, I have a general question about the human body. What happens to us over time that might lead to us needing a structural adjustment from a chiropractor?
Okay, so that's one of the reasons we take the X-rays is because the arthritis. If you develop arthritis or degeneration in your vertebrae, that's going to show up on X-ray. And if you injure a joint, whether it's your neck or your elbow or your wrist, if you injure a joint, you're 7 times more likely to develop arthritis in that joint. So over time, say you have a sports injury when you're 18. By the time you're 35, you're going to have some issues. You're going to have some degeneration in that injured joint. I don't know if that answers your question or not, but and as we get older, you're going to have wear and tear on your spine.
So let me get a little more specific. We hear quite often about the dangers of sitting. Some have called it the new smoking.
Correct.
What happens exactly when we sit? Why is that such a bad thing?
It's just the way the spine is curved. When you sit, you're putting more pressure on your spine than any other position, including standing. So as we're sitting here right now, we are putting more pressure on our spine than any other position. That's why I have a lot of truck drivers. You're in the seated position for hours upon hours, and then you add that vibration of a big truck, even a small car, but it just tears up their spine. It's putting stress in your spine. I tell my patients that sit 8 hours a day, at least once every hour and a half, just stand up and just take a little walk, not for 10 minutes, or if you're taking a long trip, stop halfway, take a little walk, just get out of that seated position, just for a little bit. But that seated position is going to load your spine.
So is that the primary reason people come in? Is it mostly lower back?
That could be neck pain.
Okay, a lot of
Yeah,
neck
low
pain from
back
that
pain is
too?
probably one of the most common, but
Okay.
I get a lot of headache patients, neck pain. But yeah, low back's probably the main one.
Okay.
I don't have those numbers, but going off, well, that's usually they call my back's killing me, low back's killing me.
Yeah,
Or,
for sure.
so
Can we go back for a second when you said you're loading your spine? What
just
does
putting more
that mean?
pressure.
Just more
So you're
pressure?
going to put more
So,
pressure on the discs and the nerves. It's just putting downward pressure on it. Yeah.
okay.
And is what I'm doing here, crossing my legs, is that even worse probably?
Actually, it helps a little bit.
Oh, really?
Okay.
It takes a little bit of pressure off the back. So I tell patients this. Just getting that leg up a little bit will take pressure off. So if you're sitting all day, you want to get something under your feet. Just get your knees a little bit above your hips. And I tell people that if you remember the old bars, the saloons have the brass rail.
Correct, yeah.
That's there. So when you're standing there, you put your foot up on there and you have less back pain and you stay and drink more beer.
I'm suddenly very aware of my posture. Like,
But that
maybe I'll
it'll
go ahead and
take
put my leg up.
getting your knee up a little bit will take some of that pressure off the low back.
Okay.
All
I
right.
feel a little bit better now. So, and Dr. Schaefer, we had a lot of runners in our audience. What can you say to them? What does running do to the body?
Running is actually good. Motion is good. Now, you're going to have some wear and tear on the knees and stuff, but motion is good. People they get in pain, they just want to sit around. But that's my whole job is putting motion in the spine. That's exactly what I do. So, far as runners, take care of your knees, and there's all the. I'm not a expert on running, but you don't want to be running on uneven terrain and all that basic stuff. But I say if you're running, great.
So, what piece of advice would you give to maintain like a strong structure and movement
Well, you
just
obviously
over
want to
time?
have a strong core. That's going to help your spine. People think, oh, it's your abs and you want the 6-pack abs, but that's actually going to help strengthen your spine. And then what I typically recommend to patients is a maintenance routine once we're done with their initial trial of care. And that could be twice a month. That could be once a month, depending on you. But we recommend a maintenance care, and we use the phrase, you don't wait till your teeth hurt to brush your teeth, if that makes sense. So once we've done all this work to get you back from the low back pain you came in with the first place, we like to maintain it. Now, do people listen to that? Half and half. Some people say, I'm good, I'll see it. But we recommend that we stay on it. And that's not 3 times a week for 10 years. I'd say on average, my maintenance patients come twice a month.
So it's kind of a mixture of a proactive and a reactive.
Yeah.
Kind of go back
It's
and forth.
easier to keep it away than it is to start from scratch.
And in between, do you give them a program? Are there things they can do at home as well?
I typically don't give home recommendations. My job is to keep your spine in alignment. And it's kind of like you go to the gym. You're not building your muscle at the gym. You're lifting weights at the gym, but you're building that muscle when you go home and you rest. So I put your spine where it needs to be. And I really don't give I mean, I give some ice or heat recommendations, but I don't put people on on an exercise regimen or anything like that.
All right, so let me close this segment here. Are there things we can do, and this is no disrespect to you, are there things we can do that we don't have to come and see you? Or is it just a natural progression of the human body?
You really can't adjust yourself. You can't. And let's say you hurt your neck and you go to a physical therapist and they're going to strengthen, and they're not moving that bone. The bone needs to be moved. The joint is not functioning correctly. Now, if you have a knee replacement and you got to strengthen that knee, go to your physical therapist. They're great for that. But there's really not much you can do. That's why I have a job. And like I said, as a chiropractor myself, I cannot adjust myself. I've tried.
Okay.
Well, that's a good question. Do you go to someone else then?
I do.
Okay, so you have someone that you trust
Yes.
with your body. Okay,
Yeah, I go once a week.
nice.
So I'm curious, in your opinion, what makes for a good or a bad chiropractor, a good experience? Why do you go to the person you go to?
Honestly, because we're very similar. We met at my gym, and we adjusted each other, and we looked at each other, and we were like, wow. And it's experience. I mean, you know, when you get out of school, you need that experience. You know, in school, you come out and they get you close, but you got to have that experience because you're going to see all types of cases. You're going to see a 60-pound dancer or a 450-pound football player, and you got to be able to do everything in between.
Okay.
So experience, I think, goes a long way.
Good to know. So when you do different treatments, like I know you've mentioned the adjustments,
Mm-hmm.
what is a treatment regimen? I know that like there's stem therapy, there's ice or heat. Like what all do you normally incorporate into your process?
In my office, we use electric muscle stim, which is just a electrical stimulation that'll excite the muscle tissues to the point where they fatigue. It just relaxes you.
Okay.
It wears the muscle out.
How long does that last?
A few minutes, less than 5 minutes.
Okay.
And then we have an intersegmental traction table, which people call a roller table. You lay on your back and it rolls up and it puts motion into the spine. It'll get nutrients into your discs. We do some moist heat, which goes deeper than a dry heat, again, just to relax you. We do some minimal exercises, stretching. But typical visit is we keep our focus on the adjustment. We don't get into shock wave or have a massage therapist or nutrition or sell pillows. There's nothing wrong with any of that. That stuff's all great, but we keep it back to the adjustment itself. That's the focus of every visit in my office.
Okay. When you're talking about I just forgot the term. It's
Electric muscle stimulation.
muscle stimulation. For anyone who's never done that, does it hurt? What does it feel like? What's the
Most
experience
people
like?
think it feels really good.
Okay.
It feels similar to a TENS unit if anyone's ever had a TENS unit. It feels just like a tingling.
Okay.
It's very different from a TENS unit. It's a different frequency, and it actually causes a contraction in your muscles, just like if you flex your bicep, so long that muscle fatigues. And it feels, people with like spasms, they love it. It feels really good.
Okay. So it doesn't make the muscle cramp.
It causes it to contract on a cellular level. Sometimes you'll feel it. Most of the times you don't.
Okay.
But on a cellular level, it's contract. If I put that stim machine on your bicep and turn the machine on, your bicep would contract.
Okay.
And that's what it's doing to your spinal muscles.
Okay. Good to know.
So forgive me if this is a silly question, but is that the extent of the work you do with the muscle? Are you primarily working on the skeletal structure there?
I do what's called trigger point therapy or myofascial release, or
Okay.
pressure points.
Elaborate on that. What does that mean?
So that is a technique where if a muscle is injured, overused, or chilled, it's going to develop a nodule or trigger point, which is mostly lactic acid. And that develops in the muscle belly. And that becomes an irritant and makes the muscle spasm even more. And it's usually by injury or overuse. And I find those and I press on those and break up those nodules, and the body will flush those toxins out, and it actually relaxes the muscle. So that is part of my treatment as well. They call it trigger point therapy.
So is the ultimate goal a relaxed body, a relaxed structure?
We want you as relaxed as possible for the adjustment.
Okay.
That's just easier on me, and it's easier on you. And that's the purpose of the muscle stim before the treatment.
And then when I leave your office, what should I be feeling? How should I feel?
You're not going to feel, people think they're going to walk out of there healed. You're going to, the first visit or two, you might be sore. If you haven't gone to the gym in a year and you go back to the gym, those first 2-3 days, your body's going to say, what's going on here? We move stuff around. So the first 2-3 visits, patients, I tell them they might actually feel a little worse. But then once your body's used to that, you're going to start feeling better after each adjustment.
So now that we are becoming more educated on chiropractic care, who should see a chiropractor?
If you have a spine, you should have it checked.
So at the very least, get it checked.
Get it checked.
At a certain age, do you recommend? Or
Well, the birth process is one of the most traumatic things you'll ever go through. So a lot of chiropractors will check newborns because they use forceps on your head. It's very traumatic. And so you should be checked right then and there.
and are there people who should not see a chiropractor?
There's contraindications. But there's also techniques to address that as well. So if you have severe osteoporosis, you probably don't want to be getting a high velocity adjustment. Now, there's other ways to adjust someone with that condition. Any ligament damage, any recent fractures, there's contraindications to getting adjusted. Yeah, you can't adjust everybody.
Trying to think of any friends that have either had like a spinal fusion, back surgery, anything like that. Would that be contraindicated? Is it still safe?
No, I've treated them. So I have patients that have had spinal fusions. I can adjust them above and below the fusion.
Okay.
And I've done that before. Yeah, you got to be very careful.
Sure.
But yeah, I have patients currently that have had laminectomies, spinal fusions. Just have to be very careful, but you can adjust them above and below the surgery.
Okay. I think if there was one point that you'd want to address today to make sure that our listeners kind of fully grasp and understand about chiropractic care, you want to reiterate, what would that be?
The biggest thing I would like to get across is it takes time. People think it's an instant fix, and they go in and, they've had back pain for 5 years. They do construction or they drive a truck and they want to be fixed. And after 3 visits, they're not 100%. And then they drop out of care and saying the guy didn't, or the girl didn't help me at all. So I think the biggest thing is there's no process that doesn't take time. So I think people don't realize how long it takes. It's a healing process. So if you break your arm, it takes 6 to 8 weeks to heal, whether you want it to or not. You don't want to wear that cast for 8 weeks, but you have to. So I think the biggest thing is people don't realize that it's a healing process that happens over time.
Okay.
So to that end, is there a finish line?
There shouldn't be. I can't imagine not getting adjusted ever again, but that's me. So as I spoke about earlier, you should maintain what we've done. And it might be once a year. But if you're a truck driver, it might be once a week. So when I treat a patient and we're done, I give them 2 choices. We can stay on this and we can maintain it, or you know what, Tim, it's up to you. You want to come back? I'll be here waiting for you. And we can, if you ever need me again in the future, but then we're back to 3 times a week again. And we're starting. So usually it's the second round. They come the first time, they don't want to do the maintenance because they feel good. Then the second time we're back to 3 times a week again. Then they say, okay, I might want to stay on this. So is there an end point? That's on the patient. And I don't force that. I don't say we have to maintain this. I say, I recommend we maintain this. And if you want to wait till it comes back, I'll be here waiting for you.
So just curious, what drew you into chiropractic care?
My brother knew from the time he was 12 years old. He knew he was going to be a chiropractor. And so I kind of followed him. And that's how I got into it. So I went to visit him in school, and we were touring the school. And of course, the admissions lady got a hold of me, and she's like, well, what do you study? I was at Penn State. And she said, what are you studying? And I was doing genetic engineering, actually. And so she's like, oh, you have the biologies, you have the organic chemistries, you have the physics, she's like, you pretty much have everything you need to be a chiropractic student. And that's how I got into it. So.
And would you recommend it as a career for some of our students?
I love my job. The insurance part of it can be a little bit tricky, but I love what I do. I would recommend it to anybody.
Yeah. I like to go back for a second because as you were describing kind of the care and maintenance routine,
Mm.
um, I got hurt a lot in high school, so I spent a lot of time doing PT.
Mm-hmm.
But I just kept thinking like I would go to PT, do physical therapy, but it would be sometimes 2 or 3 times a week. I have to do that for a couple months, then hopefully I get better and I'd be off and running.
Mm-hmm.
But then I'm hopefully still, be exercising and using all those things that I made. But when it comes to the spine, I guess I always thought, if something's out, you put it back in and now it locks in. But the spine is actually much more fluid. Is that correct?
Oh yeah,
In terms of,
it's very flexible. They'll tell you one vertebrae moves 14 different directions. So you sacrifice stability for mobility. So if your spine was just one big bone, you would never have back pain, but you wouldn't be able to move. You wouldn't be able to bend over.
right.
So yeah, it's very flexible and unstable. So you could just sleep wrong. People will say, "Oh, I think I slept wrong the other day." It could be something as simple as that, and then your body tells you, "Hey, something's not right."
Okay.
Yeah, Dr. Shaffer, is there any general maintenance tips you can offer us to maintain a healthy spine?
Yeah, motion. Keep moving. A body in motion stays in motion. So people get older, they want to sit around, they don't want, if you're injured, you want to sit around, you want to do anything. You got to keep the body in motion. And that's my job. I keep the spine in motion where it doesn't have the proper motion.
And a few times today you've mentioned arthritis.
Mm-hmm.
Can you speak a little bit to that? How does arthritis occur over time?
Okay, so when a bone is not working properly, it's going to wear and put wear and tear on that joint. The best analogy is misaligned tires. If your tires are misaligned or your vertebrae is misaligned and you drive to Cleveland and back, your tires are going to wear out way quicker than if they're in perfect alignment. So if you have it could be your elbow, any joint. If it's not functioning properly, it's going to wear down quicker. And again, if you had an injury earlier in life, that's going to happen even quicker.
It's a great analogy. Sorry, it tracks with
That's
me. I'm
great.
a car guy. But
Yeah, no, that's
It's
great.
the easiest way to explain
Sure.
this.
And if I do have arthritis,
Mm-hmm.
can you help with that?
Yeah.
Or are you just
The
sort of
be-
managing my pain?
We're not going to reverse it.
Okay.
We're going to keep it from getting worse. So if, let's say, we take an x-ray and you have a giant bone spur down here, that's arthritis. That's the body laying. So a bone spur would be like if you worked with ropes all day and you got a callus on your hand. That's wear and tear.
Mm-hmm.
So your body will lay down a callus, extra skin. So your bones will do the same thing. They'll lay down extra bone as a spur to like splint that joint. Now, some chiropractors will tell you, well, if we get that proper motion back, the body will actually resorb that spur. And I've never seen that in 32 years of practice, so I'm not going to say that. What I will tell you is, let's say your disc's wearing out and it's getting pretty thin. We can keep what little bit you have left. We can keep by restoring the motion. The best thing for arthritis is to get that bone in the proper motion again. So we're not going to reverse it, but we can stall it and maybe even freeze it.
Dr. Shaver, thank you for just taking time to come out here. And
Not a problem.
This is definitely informative.
Absolutely.
Learning new things.
Wonderful.
Yep. And to our listeners, just a reminder that you can find us on Spotify, Apple Music, or anywhere you find your podcast. As we had the spine model here today, it's also a good reminder that we are also on YouTube. You can check out our Portage Learning in Between Tides channel. You can watch all the different things we were doing today. As always, if you have any questions or comments, we'd love to hear from you. And thank you for listening.
Thank you, Doctor.
Thanks for having me. I appreciate it.
Thank you.